Well, hi, welcome to the podcast. I'm Mark Graven, Senior Advisor with KaiNexus. And I want to tell you about an exciting webinar that's going to be presented next week, May 18th, 1 o'clock Eastern, our usual KaiNexus webinar time. And it's titled An Innovative Patient-First Vaccination Clinic Design. It's going to be presented by Dr. Joy Dobson. She's a Senior Physician Consultant at 3S Health in Saskatchewan, up in Canada. And you can register for this. It's free to all. Everybody's welcome. You can go to www.kainexus.com/webinars. And really happy to be joined today with the presenter. Again, it's Dr. Joy Dobson. Joy, how are you today?
I'm great, Mark.
Well, thank you for giving the preview. Thank you in advance for the webinar and everything that you're going to share. And I should say also thank you for the important work that you and your colleagues are doing up there in Saskatchewan related to COVID vaccination. Before we talk about that and give a little preview of the webinar, could you introduce yourself a little bit for the audience first?
Sure. I was born and raised in Saskatchewan. It's a pretty rural province, a large geographic area, but I've been in healthcare for over 40 years. Most of my career, I was an anesthesiologist and critical care physician, but branched into leadership roles fairly early on. And at one point was what I called head coach for our 600 doctors in the southern half of the province. And retired from bedside care to focus what I now call doing system care. So currently I'm with 3S Health, which is a provincial organization that does procurement for health services for the province. So everything we do is standardizing to best practice across the province. And I've been involved in lean and quality improvement for a long time. And when I was asked if I would be part of the team helping our province's vaccine rollout, I couldn't have asked for a better chance to help in this weird and wonderful world we're in right now.
Yeah. And so when you say system care, you think of the organization, the hospitals, the clinics, the teams as the patient, I guess, nowadays?
Yeah, because obviously as an anesthesiologist, you're entirely focused on that one patient in front of you. But I realized if you pay attention to try and make improvements to the system, your impact is far greater. And I've always said my purpose in my work life is to make a difference for 1.2 million people in the world. That's the people of this province. And I actually believe that's all any of us want to do is make a difference. We just define world differently. Maybe it's just your family, maybe it's your city, maybe it is the globe. But right now, that's truly what I feel we are doing. Yeah.
Well, I know you're focused on the 1.2 million people of Saskatchewan, but through the webinar and through other sharing that you've been a part of, that's spreading that impact, that knowledge and the experiences and the experiments and the things that you've been working on. We'll have a global audience tuning in for the webinar. So I appreciate you sharing some of your time and your knowledge more broadly.
Well, thanks. I like to think that that's part of our Saskatchewan way. We consider ourselves the birthplace of Medicare in Canada. And we've been doing some innovative things in Canada around mass vaccine clinics and a way to get needles into arms.
Yeah. And so some of that innovation, I think we've seen it as we've talked about with people as we've done our networking about vaccination clinics. There are many different models. There are many different ways to set up a vaccination site. I was wondering, you're in the webinar, you're going to share some of this innovative approach of what you call a patient-first vaccination clinic design. Could you share just a little bit of a preview of like what inspired you to look at this different model and what does it mean at a high level to have this patient-first approach?
Well, what inspired it was, of course, anyone who's done some work around lean and quality improvement knows about the U-cell concept and moving the work sort of close. And in Saskatchewan, we actually had a very large review of our health system called the Patient First Review that said we need to be customer-centered, not provider-centered. Let's focus care on what the patient truly needs and values, and not just what works for providers. And, that's a it's a bit of a mindset shift. Anyway, with that sort of two things in my Saskatchewan brain and maybe my anesthesiologist, when I didn't know how we normally set up clinics. So I just thought, what's the fastest way you can do this? Well, line them all up. And as an anesthesiologist, just go poke, 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 poke. And there you get them all done. So we thought, let's have our immunizers move to the client instead of the client move to the immunizer. So I hadn't realized the traditional clinic setup was, the client moves from spot to spot to spot in care. And instead, we thought, no, bring it all to them, get rid of the need for observation space and staff, and focus on a system that's kinder to patients. Happens to be a bit more efficient as well.
Yeah. And we're going to hear a lot more detail about that in the webinar, I know. But it's interesting to look at these different models in healthcare. When I've seen vaccination clinics, the patient moves generally from kind of an intake area. You get some questions posed to you, and then you move to another station, and then maybe some data is entered and captured about you, and then maybe you move to another station, and then you get the poke in the arm, and then you go to another area where you sit in a chair and you wait to see if you're going to have maybe a reaction and you're being observed. So some places might combine two of those, where you have two people at a table, both getting your information and entering it and telling you things, and then someone else is getting ready and they're poking you in the arm. But what you're talking about really is the patient comes in, sits down once, and everybody comes to them, right?
That was the initial way we envisioned it. And that's one chair, one client, one stop, one shop and done. And we're still working toward that goal, but been pretty impressed with what we've done in just a few days of pilots.
And you'll have another week under your belt before the webinar. But it's just thinking again about different care models. If I go to primary care, the MA comes in, the doctor comes in, like they're all coming to me. But then if I go to the ophthalmologist, because there's specialized equipment in different rooms, I'm going from point to point to point. It's just maybe some that's driven by specialized equipment as opposed to generic exam rooms. But I think there's this opportunity always to step back and question the way we've always done things. And I wanted to maybe ask you a little bit about some of your original lean teachers, because you might not address that during the webinar. People who challenged you to challenge the status quo. I was wondering if you could share a little bit about I know you had some great teachers and mentors.
Well, I have. So I personally have visited Theta Care and met John Toussaint. I was in Winnipeg as well, where they had done some lean work, and I'm losing the name, but he's since passed away, but they had done some amazing work.
In Winnipeg, you mean at St. Boniface?
Yes, at St. Boniface.
Michel Tétrault was the CEO.
Right.
He did pass.
John Black did a lot of work in our province. I actually was also in England for releasing time to care training with Helen Bevan and her team. So I've been very, very, very blessed to be exposed to some titans in lean and quality improvement in the world. But I guess as an anesthesiologist, maybe part of it is just natural too. Like I remember just as a trainee in Calgary, again, Jan Davies, who's a patient safety titan in the world, had each resident do a quality improvement study. We showed that if the patient leaves the cardiac OR hypothermic, they're going to return for bleeding. And so, that was just part and parcel of how you do your work, it seemed. Have to brag a bit. Anesthesiology is one of the few Six Sigma medical areas,
And there has been quite a bit of improvement and looking at systems, back to what you were saying earlier, not just telling the anesthesiologist, hey, be more careful. Like when you look at the equipment and process. The great systems work in anesthesia, right?
Well, and they've truly pokey-oked many of the things. You cannot hook the oxygen up wrong if you try. Our pin index system prevents that. there's been global standardization around anesthetic gases, IV catheter size, designs, color coding, shadow boards. Yeah.
So you've got that background plus your lean training and mentors, and yeah, it's led to some really interesting work that you're doing there in the clinics. So again, the webinar, the title is An Innovative Patient-First Vaccination Clinic Design. It's going to be presented by Dr. Joy Dobson. And I would challenge anyone who's listened to the preview here. I think there will be a lot of interesting and thought-provoking from what I've heard of this model so far. I would invite you to come and listen, even if you're not doing work around vaccination clinic design, and even if you don't work in healthcare. I think there are going to be a lot of really interesting ideas presented. So I hope people will tune in for that. Again, May 18th, 1 o'clock Eastern Time. You can register at kinexus.com/webinars. If you can't make it live, we always record these and we'll send it out to everybody the day afterwards. So we're going to be talk of the lean concepts and innovative practices. Is there anything else that you would want to add here, Joy, as we wrap up as kind of a preview or a teaser or just a final thought for today?
Well, here's what I'll say. We've got a pretty strong team in Saskatchewan who use lean and quality improvement science, but also we've stolen shamelessly from everyone we can, and we've still got a lot of learning to do.
A lot of learning, a lot of experiments, and that's going to lead to that learning. So thank you.
Exactly. If you don't try, you'll never learn.
Yeah. So thank you for setting that tone and sharing that example. Again, thank you for doing the podcast. Thank you for the webinar, and thank you for what you're doing up there in Saskatchewan.
No problem.